So if on a fairly regular basis, usually your big toe, this can happen to your thumb, sometimes your knees. If every now and then you get this feeling like one of your joints in your body is just trying to murder you and it hurts like crazy, there's a decent chance that you've got gout. Maybe you've got a family member who's dealing with gout. And one of the problems with gout is it seems to come back quite a bit. And we're going to talk a little bit about gout flares, how to treat them, and then to me, a potentially even more important thing is how to stop them from coming back all the time. Because gout flares are painful. When I see someone just limping, almost crying into the office, I always try to think like, how often are they going through this, and how can I stop them from having to go through it so much? So let's talk about some things, because there are a lot of people who have, I think, pretty untreated gout or undertreated gout, and I think there's some ways to get through it. So first of all, when you have those flares, depending on the right person, kidney function and all that sort of stuff, colchicine is a medication where it helps deal with the inflammation. And then there is steroids, which also help calm down with that reaction and that swelling and that pain and that inflammation phase. So you'll often get put on a pretty specific tapers. Those have some very specific instructions, so talk to your physician about those. And you'll ride those out to get you through the flare. And then the longer discussion starts happening, which is like, well, how often are you having these? If you're someone who has a gout flare, once every 5 years it happens to you. Maybe once a year and it's minor. Maybe you don't want to start talking about getting into daily medications, and your goal is to largely control it by staying hydrated, avoiding the classic trigger foods for gout. You're going to try and stay away from alcohol, not do too much red meats, the high fructose corn syrup, that sort of stuff. Maybe that works for you. But if you're someone who's saying, you know what, I got to go in every 2 months and I've got to get my meds because I'm going to have a 2-week flare of my gout, it's probably time for someone to talk to you about why you're having so much of that. And the first step in most cases is to check your uric acid level. Uric acid is a chemical that our bodies can build up, and when it builds up too high, your chances of getting a gout flare, that painful joint inflammation, really, really goes up. And the goal is for that number to kind of stay below 6. That's kind of the established guideline treatment goal. And if you're someone who's having all sorts of flares, you might find your numbers somewhere around a 7, 8, 9, 10, something like that. And we got to try to find a way to get it back down. Sometimes you can lower it a lot by just hydration and avoiding those trigger foods, right? But some folks are going to need some extra help. And the first line for most patients ends up being a medicine called allopurinol, and that can be a daily medication that you take to lower that uric acid level, which cuts down how often you have those gout flares. So it's annoying to take a daily medicine, but sometimes we just need medicine, and it might be able to save you multiple flares per year and really push out the time frame for the next time you're going to have one of those. The important thing is this, allopurinol is not a medicine that you start during a flare. It's kind of widely believed to cause a worsening if you start it during a flare. You don't stop if a flare happens, but you starting during a flare for whatever reason, I'm not sure I even understand the physiology of it, but it causes issues. So make sure you talk to your physician about that. But when I find someone I'm treating for a gout flare and I find out they're getting them all the time and we haven't been checking their uric acid, I want to check that uric acid. I want to get them through that first flare, and then once that's over, I want to talk to them about maybe starting a uric acid lowering medication. There's multiple that exist if allopurinol is not for you, but it's a thing you need to talk to your physician about, because if you are having multiple frequent gout flares that's really changing the quality of your life, chances are that your gout is undertreated and there's ways to find some improvement.